I'm originally from Syria. I'm from a city called Homs, which I believe is very famous right now. Everyone knows this city. I lived there during my childhood, my high school. Then I moved to Damascus. This is where I studied medicine, and I was there until I moved to the States. So I moved first to Rochester. I was doing research in Mayo Clinic for about 6-8 months. Then I went to Chicago. I had my residency training there for 3 years, and I started practicing here in Decatur. My father is a surgeon, and since I was 6 or 7 years old, I used to always beg him to take me with him to the clinic, and I used even to go with him in the OR. I would stay outside and just watch him through the glass and do his operation since I was a child, and everyone used to call me Dr. Dima, Dr. Dima, so it just is something that I grow into since I was like a child. Yeah, so I always knew that I'm going to be a doctor. When I was in school, I really liked the biology. I liked everything that has to do with the human body, how it works. Things make sense. You get to know things that you take for granted. Like when you are in internal medicine, this gives you the opportunity to just continue to learn throughout your career about everything that's happening in your body. Also, working in internal medicine makes you in direct contact with all the issues that the patients go through, and gives you the opportunity to give them a hand and help. I would like them to know, I know that there's a lot of frustrations with the patients, that they don't feel that their doctors are connected to them. I want them when they leave the room to know that I do feel what they're going through. I want them to know that I do understand their suffering. And I want them to know that I really care about them. It's not just a profession that I'm making money out of. I want them to know that they can come to me with problems. So this is what I hope for once they're leaving the room, to leave that impression in them. When the patient says thank you, when I feel that they're satisfied, when I know that I am making a change. It's a frustration for us as physicians because sometimes we know that there are things that we cannot change, like we can go around it, we'll try to make the patients feel better. But when I see that I am making a change in their life and making their life better, this is a very rewarding moment for me. I'm a painter. I used to have exhibitions when I was younger. I do oil painting, water painting, but not as much. I used to play music when I was younger. I used to play the piano. I like to read novels. I like South American literature. I keep up with the South American literature a lot.